Hello, my science lovers. This is ScientistMel Shorts, a shortened version of my live streams for people who enjoy science but are short on time. So let's go ahead and get started. So for this particular episode, we are going to talk about all things related to depression. So what is depression? What is it? What are the types? We're going to talk about the symptoms, the risk factors, who we see that is statistically speaking has depression, what are the treatments available. We're also going to talk a bit about suicide, which is a hard topic, so I completely understand if some of you can't take this at this time. If you're not, you can always watch it later when you feel up to it. And we're also going to talk about what we can do. Depression. According to the National Institute of Mental Health, an NIH branch, depression is a major depressive disorder that is common but serious. It is considered a very serious mood disorder. It causes severe symptoms that affect everyday life. This can be how you feel, how you think, how you handle just regular day-to-day activities. It can affect your sleeping, your eating, and even working. Now, in order to be diagnosed with depression, the symptoms have to be present for at least 2 weeks. Now, the thing that I want to hit home in this, it is severe. The symptoms are severe. It's very common. And it affects everything, and a lot of times every day. There's going to be some kind of manifestation of depression for a lot of people, not everyone, but for a lot of people, some form of it every day can be present. It can happen. So the different types of depression. Much like everything, depression is a spectrum. There are varying types, and each can have different levels of symptoms and triggers. I'm going to go through each of these here so we can understand what they mean and how they affect those who are diagnosed. So we have persistent depressive disorder, postpartum depression, psychotic depression, seasonal affective disorder, and also bipolar disorder, which in itself is not depression, but it can be categorized as a type of depression because of the symptoms associated with it. So, let's go over a little bit about these different types of depression. Persistent depressive disorder, it's also called dysthymia. It's a depressed mood that lasts for at least 2 years. So this particular person, they can have this persistent type of depressive disorder. You can have episodes where it's major full-on depression, and then you can have periods of less severe symptoms. Now the symptoms must last for 2 years to be considered this particular type of depressive disorder. Postpartum depression is not just baby blues. Baby blues is something where you kind of feel a little bit sad, it's mild depressive, there are some anxiety symptoms that happen right after a baby's born, but they can tend to kind of clear after a couple of weeks. Now, when we're talking about postpartum depression, these women experience full-blown, full-on major depression during pregnancy and or after delivery. The feelings that are associated with that tend to be coupled with extreme sadness, lots of anxiety. They're exhausted most of the time. And these particular symptoms that accompany postpartum depression may make it difficult for new mothers to be able to take care of their babies. Psychotic depression is a bit different. This occurs when a person has severe depression, but it is also coupled with other form of psychosis. This can be hallucinations or even delusions. Now, these particular hallucinations and delusions are very, very upsetting. And so these particular types of manifestations can usually have some kind of theme associated with it, whether it be guilt, poverty, or illness. Seasonal affective disorder. This tends to be the onset of depression at winter time, when there is not so much natural sunlight. Now, this depression doesn't necessarily go away completely, but it tends to lift a bit during the summer and spring months. This can see, usually with this type of winter depression, we see social withdrawal, we see a lot of sleep happening, we can see weight gain, and it's very, very predictable. Some doctors actually know a few people that suffer this type of depression. They have sun lamps next to their bed. They turn it on, blast them with some sunshine. Sunshine is actually important for certain biochemical reactions to happen in our body, our circadian rhythms. And so for some people who suffer insomnia, another thing that they can do, and some doctors recommend, this doesn't work for everyone, but as soon as you wake up, go outside and get you some sunshine to kind of trigger the beginning of your daily biochemical reactions, so you have your natural cues at night when it's time to sleep. Similar things happen in regard to seasonal affective disorder. Bipolar disorder. Now, it's different from depression, but since it has a lot of the same symptoms associated with depression, it's kind of categorized and grouped into that. So you can have episodes of extremely low moods. You can have people who experience extreme highs, euphoric type of moments, and irritable moods called mania. And then the less severe form of that mania is hypomania. Now, other types of depressive disorders that have newly been added to the diagnostic classification of DSM-5, that includes disruptive mood dysregulation disorder, primarily seen in children and adolescents, and premenstrual dysphoric disorder, PMDD. So those are kind of new depressive disorders that they're still kind of looking at and trying to get more information about. So to just kind of wrap up a little bit on this particular section, persistent depressive disorder lasts at least 2 years. Postpartum depression, major depression after birth, but can also happen during pregnancy. Psychotic depression is depression linked with some kind of psychosis, usually delusions, hallucinations, this sort of thing. Seasonal affective disorder, depression that tends to have an onset with a lack of sunshine. And then bipolar disorder meets those particular depressive qualifications and criteria in order to be categorized. So now I'm going to go to the big screen here so you can take a look at all of these different symptoms. So in regard to signs and symptoms of depression, these are all kinds of different types of symptoms that can manifest in depression. It's important to note that everybody's different. Not everybody's going to have the same experiences. Some people may experience all of these symptoms. Some may only experience a few. So we have this persistent sad anxiousness, this empty mood, hopelessness, pessimism. We have irritability. We have individuals who feel guilty and worthless and helpless in their situation because what's happening to them is not in their control. They lose interest in pleasure in things that they used to love, hobbies and activities. They have decreased energy, they're exhausted, they're moving or talking slowly. So some individuals actually have a hard time formulating sentences and words. So this is a real thing that can happen. They feel restless or have trouble sitting still. There's difficulty concentrating, remembering, or making decisions. They have difficulty sleeping. They wake up too early, or they oversleep. They can have appetite changes where, they can gain or lose weight. Now, the big thing here is thoughts of death or suicide attempts. It's very real, and we're going to get into a bit more of that. The other thing, people who suffer depression can also have aches or pains, headaches, cramps, and even digestive problems. So all of these things are very, very real, and they're super they're super hard for individuals to deal with, especially if you're being hit with a whole lot of these at one time. So let's talk a little bit more about what we expect in this. So lots of these crippling symptoms, it can overtake a person pretty quickly. So it's important to note that people are different and symptoms will be varying in degrees. Not everyone will experience every symptom at once or at all. It's important to take note of symptoms over time to help you understand if there is a problem you need to address. If you are uncertain, speak with a doctor to help you determine if you have clinical depression. So now I'm going to talk a bit about risk factors. All right, what are the risk factors associated with depression? Personal or family history of depression. You can have major life changes. So we kind of see a genetic link with personal or family history, maybe. Major life changes. You can have trauma, stress. There's certain physical illnesses and medications that can kind of trigger depression. So if you have like a massive physical illness that completely restricts you, it's really hard to, and especially if it affects your happiness and your able-bodiedness, sometimes that can be a trigger for depression. Medications. Certain oral contraceptives have been linked to severe depression in certain women. So if you notice your mood changing a bit, you need to kind of keep that in check to see, am I being affected by these hormones I'm taking? And also, LGBTQ individuals and transgender youths are at a higher risk for depression and suicide. So let's talk a bit about this, especially when we're dealing with who this hits. Depression can hit anyone. It can hit anyone at any age. It knows nothing about success or gender or privilege, money, friends, sunshine, hobbies, or life's demands. It is a selfish monster that cripples a person to the point they can barely form words or get out of bed without excruciating pain. Depression is a liar, a thief of happiness, and an expert manipulator to force you into a constant state of pain where all you can think of is ending the torment. So when you consider a person that's in a depressive state who suffers chronic depression, keep in mind they could have a battery of symptoms hitting them at any time and in varying degrees of intensity. So it's not something somebody can just get over. Doesn't matter if they have money, doesn't matter if they're successful, doesn't matter what their gender is, doesn't matter if they're privileged. Depression is very real and it hits people of all types and all ages. So let's talk a bit about treatments, medication, therapy, and activities. So there's all kinds of different treatments available, and it depends largely on the type of depression that you have and also what has worked for you in regards to your coordination with your doctors. So not everything's going to work for everyone, and there are different treatments there are certain treatments that are more suitable for certain cases. So let's go through a few of these. I'm going to get into a bit of this, and so bear with me. Let me see. Here we go. Bear with me. All right. So the first thing we're going to talk about are antidepressants. Antidepressants are types of medication that actually treat depression. They can help improve the way your brain regulates and uses certain chemicals in order to kind of get you more of a balance. It can take several different types of antidepressant medications before you find the correct medicinal cocktail that's useful to you and works for you in order to eliminate your symptoms or at least reduce them to a more manageable state. They can take as long as 2 to 4 weeks in order to actually kick in before you start to feel your mood change. But it can happen a lot sooner as far as the other symptoms of being able to focus a bit better. So being able to focus, sleep, and appetite, these sorts of things, they tend to improve a lot sooner than your mood does in regard to antidepressants. Now, something to keep in mind, in some cases, especially with children and teenagers, as well as young adults under 25, antidepressants can actually increase suicidal thoughts and behavior. So this is important to kind of keep an eye on that dosage. So as you're talking to your doctor, if you're going to go on antidepressants and you're within that particular group, certainly your doctor is going to know what the latest research is in regard to that. And this is a warning that comes from the FDA. So you can go to FDA.gov and have a look at that particular information yourself and kind of read up a bit on those particular cases. So antidepressants are actually quite useful, and they're something that can help a lot of people out in regard to potential therapy. Another thing that you can do is something called psychotherapy. So there's the talk therapy, which is also called counseling. You have CBT, which is cognitive behavioral therapy. That's a type of treatment that's shown to be proven pretty effective. There's also interpersonal therapy, and there's also problem-solving therapy. And all of this information, and the information I'm giving you, you can go to the NIMH website. That's the National Institute of Mental Health, a division of NIH, and you can download the publication Depression, What You Need to Know. That is all available to you on that website, and you can check it out. Brain stimulation therapies. Sometimes medication doesn't work, and in order to reduce the symptoms that you have for depression, brain stimulation can help. It's called electroconvulsive therapy, also known as ECT. So it tends to be an outpatient type of procedure, and you go under a general anesthetic, and you're giving a muscle relaxant, and you don't feel any of the electrical pulses that go on in your brain. It usually goes on for about a month, and then you visit 2 to 3 times a week for each individual treatment. There are some side effects, but they tend to be short term. A little bit of memory loss, a little bit of dizziness, that sort of thing. So it's important to talk to your doctor about the potential side effects, how that would affect you. ECT is a good option, especially for individuals who have not been responding to medication, and it's shown to be relatively effective. And in some cases, that's the first go-to instead of medication, especially if you have a particular allergy for a particular type of medicine. Now, if you think you might have depression, it is really important that you go ahead and start talking to your doctor about it. And you can actually, again, go to the NIMH website, and you can click on a link to find help for various types of mental illness. It's a really good resource. So let's talk about activities. There's no way you can just start running and that alleviates your depression, although that might work for some people who have them, for the less severe symptoms. If they're in a mild type of depressive state, perhaps that works for them, but that's not going to be necessarily the case for everybody else. So some things that you can try to do to kind of help minimize your episodes: try to be active in exercise. If you can, that's great. If you're in a lot of pain, exercise is not going to be a feasible option for you. Especially if you're in a lot of physical pain or have a headache or something you just can't get out there. But set realistic goals for yourself. So if you're in a very, very low state and normally you just spend all day in the bed, you might have a goal of saying, okay, today I'm going to get up, I'm going to take a shower, I'm going to eat some breakfast, and I'm going to go back to bed. Perhaps you don't shower or eat or anything like that when you're in that state. Set realistic goals for yourself and write them down. Try to spend time with other people and confide in trusted friends or relatives, people that you know you can count on. Confide in them. Let them know what's going on in your head. Avoid isolating yourself and let others help you. Your friends and your family, they love you and care about you. Well, they should. So focus on the people that love and care about you and let them help you. It's what friends do. It's what you do for each other. You would do that for your friend. You would do that for somebody you love. Let them do that for you. Your mood is not going to improve rapidly. It's going to be gradual. So it's important to keep that in mind when you're in a low depressive state, that it's going to take a bit of time before you come out of that, and that's okay. Another thing, you want to hold off on making really important decisions, especially when you're in a low state like that. Don't want to get divorced, don't get married, don't change your job, don't do anything that is life-altering while you're in that particular state, because you're not 100%. Also, science is coming out with brand new information all the time about depression, so it's really important to continue to educate yourself about it so you can learn what the new information is. Maybe there's new medications, maybe there's new therapies. All of these things are useful and can help you in dealing with your symptoms and dealing with your diagnosis. So now I'm going to talk a bit about LGBT. So we have, see, youth. There should be a TH there. I forgot to shift that over a bit more. But hey, LGBT youth. I'm going to talk a bit about these particular individuals because this is a real thing that's going on. Transgender youth are at a higher risk for suicide than probably any other group in the LGBT or straight or otherwise. 32 to 50% worldwide. There's an organization called the Trevor Project that tries to raise awareness, especially when it deals with depression and suicide amongst the LGBTQ population. You can check out their website and get more information. I'm going to talk a bit about some of the statistics they have there. LGBT youth are at a high risk for depression and suicide. Family acceptance is exceedingly important because when individuals are in a depressed state and they're suicidal, support networks are extremely important during that time. There is some evidence that show using chosen names for individuals who are transgender lowers the depression and suicide risk. So if you have a transgender boy who's genetically female, but their gender is male, if they had a female name given to them at birth and they've chosen a male name for themselves, using that male name lowers depression and suicide risk. Now I'm going to quote a study from 2016 regarding suicide in transgender persons. Gender-based victimization, discrimination, bullying, violence, being rejected by the family, friends, and community, harassment by intimate partner, family members, police, and public discrimination, and ill treatment at healthcare systems are the major risk factors that influence the suicidal behavior among transgender persons. So we're looking at not just victimization and discrimination, but also bullying, violence, rejection by the family, friends, community, harassment, not only by intimate partners, but family members, police, and public as well. Discrimination, as well as ill treatment at healthcare facilities. So even doctors are treating transgender people poorly. That's shocking to me. I mean, the Hippocratic Oath is, first of all, do no harm. And they're doing harm. This is a factor in transgender youths committing suicide. And it's quite striking and quite upsetting. And so it's hard for me to kind of swallow that. You expect doctors to do the right thing, and they're not. A lot of them aren't. And they're not being advocates at all. So I'm going to give you some statistics from the Trevor Project in regard to LGBT youth and suicide. It's the second leading cause of death among young people ages 10 to 24. Stats in 2016 have now moved that from 10 to 24 to 10 to 34. Broad range there. LGBT youth seriously contemplate suicide at almost 3 times the rate of heterosexual youths. They are almost 5 times as likely to have attempted suicide compared to heterosexual youths. Of all the suicide attempts made by the youth, LGBTQ youth suicide attempts were almost 5 times as likely to require medical treatment than other heterosexual youth. Suicide attempts by LGBTQ youth and questioning youth are 4 to 6 times more likely to result in injury, poisoning, or overdose that requires treatment from a doctor or nurse compared to the straight peers. There was a study done, in a national study, 40% of transgender adults reported having made a suicide attempt. 40% had made a suicide attempt. 92% of these individuals reported having attempted suicide before the age of 25. Before the age of 25. Almost all of them. LGBT youth who come from highly rejecting families are 8.4 times as likely to have attempted suicide as LGBT peers who reported no or low levels of family rejection. So family acceptance is exceedingly important, and it can save a life. If you reject your child for being LGBT or Q, you are increasing their risk of taking their own life. I mean, we have the statistics for that. 1 out of 6 students nationwide in grades 9 through 12 seriously considered suicide in the past year. Each episode of LGBT victimization, such as physical or verbal harassment of abuse, increases the likelihood of self-harming behavior by 2.5 times the average. So almost 3 times as much as the average youth. So these are all very serious numbers, and it's something that we need to kind of stand up and take notice about. This isn't going away, and things are getting worse. So suicide. Now we've moved on to suicide. Statistics in the U.S. in 2016. This is essentially the second leading cause of death in ages 10 to 34. This beats out homicide. This beats out cancer. This beats out diabetes. This beats out heart attack, stroke. It beats out everything that we see and we associate so much with death. It's the second leading cause of death. It's not smoking. It's not drinking. It's not car accidents. From the ages 10 to 34. It's beaten out cancer. Well, there's unintentional injury is number 1. This is a close second. Okay? And the firearms were the main instrument in 2016 for people taking their own lives. Firearms, not overdoses, not pills, not that. It was guns. Guns are the number 1 leading cause or choice of instrument for suicide. This suicide rate has increased every year since 1999. Males have a higher risk for suicide, or at higher risk for suicide than women. There was an increase in 2016 in American Indians and Alaskan Natives. So our Native American population, both Alaskan and American Indian, are at risk. They're at risk, and there was an increase in their populations in suicide in 2016. And the highest amount of suicidal thoughts are found to be in ages 18 to 25. So let's take a look a bit of suicidal thoughts and behaviors among U.S. adults in 2016. Out of our entire population, 9.8 million adults had serious thoughts of committing suicide. Of that 9.8 million, 2.8 million adults actually made plans to take their life. 1.3 million adults attempted suicide. So you have 9.8 million thinking about it. You have 2.8 million making plans, 1.3 making attempts. Of that, 1 million made plans and 0.3 didn't make plans, they just did it. So this is very real, and we need to kind of address this as people, as humans. We're all humans. We all have our own struggles, but suicide is the second leading cause of death. And a lot of these factors that we're seeing, especially with LGBTQ, these factors, we can control that. We can be kind. We don't have to bully. We don't have to victimize. We don't have to discriminate. We don't have to reject our family. These are all things that we can remove from the equation. So why don't we remove it? All right, let's look at the World Health Organization, those stats. 800,000 die from suicide annually. 78% are in low to middle income homes. This was in 2015. It was the second leading cause of death in ages 15 to 29. It's now 10 to 34 in the U.S. Worldwide, it's 15 to 29. For every completed suicide, there's some evidence for this, and the World Health Organization has more information on this. For every completed adult suicide, there are at least 20 attempts. So for every completed suicide, 20 other people have tried. That's an upsetting number. I mean, can you imagine? For every adult completed suicide, 20 have attempted. These are numbers. And this is what the statistics say. So let's look at responding. So depression. How do we respond to this? What can we do as non-sufferers to respond to depression? Because we can give back and we can do things. And so I wrote an article on ScientistMel.com on depression, how to respond as non-sufferers. And I'm going to read a little bit of that to you as a way. And the reason why I'm doing this is I had spent a lot of time working with people and collecting information, people who suffer depression. I wanted to find out what it's like for them. And in addition to that, I wanted to find out what works for them. What works for them? What helps them? And so I compiled this information together and I wrote this article kind of as a means to let them know, and say, hey, this is what I found out. So I'm going to read a bit of this to you, and I'll try to not make it boring. Okay. So for those who do not suffer, it is important we understand what is not helpful when we interact with those in our lives who struggle with the black dog. Black dog being the angry depression dog that barks at you, and sometimes it's lurking in the corner. It's still there and frightening, and it doesn't actually go away. Just some days are better than others. Things to note. There's no getting over it quickly, snapping out of it, focusing on the positive with depression. It isn't something that can be turned off or on at will. It is a full body experience. That's exhausting and hard to cope with for many people. Communication is exceedingly difficult when someone is low. Blame is harmful. People who suffer cannot control what's happening to them. They wish they could, and blaming them will hurt your relationship and cause further damage. How we respond to our loved ones and friends who suffer depression can make an impact on them, positive or negative. Now, what can we do in this case? Here are some beneficial ways to respond to depression. And especially if we have a loved one or a friend who's suffering and or having a low day. And these are things to look for and things to do. Offer an ear. They don't need platitudes or words of insincere encouragement. Sometimes they just need someone to listen without saying anything. Just listen. Tell them they matter to you with honesty. Don't be trite about it. Tell them with honesty. Give them examples of what they do to make your life better and that make you happy. Visit them often and assure them that you want to be in their company, even if that means just sitting on the couch, not talking, just wearing jammies all day and watching Netflix, not speaking, just being there. Assure them that you want to be in their company even when they're low. They may push you away as a means to cope or be less of a burden. Remind them how important they are to you and that you are there and they matter to you. Don't be insincere. Be patient and say that you are their friend. You are here. You're supporting each other. This is what friends do. You need to reiterate that and assure them that they are not a burden. Assure them that, you call me to check on me, make sure I'm okay. I'm going to do that with you. That's what friends do. Watch for changes in behavior. If a sudden shift to happy happens, stay close. Stay close to your loved one. They may be struggling, and this might be a mask. Spending time and understanding how to interact with your loved one can give insight as to what helps them when they are low. If you know, and they know on a regular basis, that you are here for them, they will reach out and talk when they need. It's important to understand it's not just them who needs to reach out. Okay? Sometimes they can't. Sometimes you have to check on them. That's how that goes. Understand that they may have angry words to push you away as they may be low. But this doesn't mean that they don't care about you. Sometimes there's a comfort in quiet. in not being around others. And sometimes this is a sign that they need care. Communicating when they are not low helps understand what your loved one needs when they do this. Being a friend or a loved one to someone who suffers depression can be challenging and frustrating at times. But you know what? This is okay. This is okay. Be certain to institute your own self-care to ensure you have a healthy outlook in order to respond helpfully. You have to take care of yourself if you're going to be an advocate and a supporter of somebody who suffers. They may have the mindset that no one cares about them. It is important to reinforce how very wrong this is. However, it is also important to understand that compassion must couple with any statements you make in regards to stating their argument is correct. You need to reinforce that you do care about them and love them, and you're going to have to say this a lot of times, and you're going to have to give examples. That's how it's going to be. It's okay. And don't be afraid to ask if they are having thoughts of suicide or self-harm. Giving your friend or loved one a free space to just talk without fear or judgment can be all a person needs. And oftentimes they don't want to hurt themselves. They just need to get the words and feelings out safely in a safe place. If you think the threat is serious, call a professional to help and give you advice. Most of all, listen. Just listen. Ask them when they are low what you can do to help them wade through that storm at varying levels of depression. Asking what their level is that day can help you understand how to respond. It doesn't have to be very difficult. It's just get to know the people in your life and get to know who they are and get to know what it is that they need. So, we've covered a lot of information here. What is it? What is depression? The types, symptoms, risk factors, who has it, the treatments available. We've discussed the hard topic of suicide, but we've also talked about what we can do, which is what's important. We can remove these risk factors of being awful to people. We can get rid of that. We can encourage and celebrate diversity and welcome each other in that kind of way. So let's educate and boost awareness. So these are all of my links. If you want to, you can go to ScientistMel.com. These slides are up right now under resources. Download everything and dive in even further. If you're an educator, man, feel free to use my stuff. Just give me, thanks ScientistMel, thumbs up or something. Or if you want to use this at work, presentation, that's fine too. Just give me a, hey, thanks so much for this stuff. This is all here for you to use to help raise awareness and boost scientific literacy and education and get the good information out there. So, I'm going to take a moment to thank all of my patrons. I've picked up some new ones lately. So, thank you Tony, James, Lauren, Jen, Carl, Melanie, Patrick, Daniel, Stephen, Paula, Tim, Carrie, Cersei, Keith, Duke, James, Zachary, Tony, Bo, Stephen, Sarah, Graham, Dragnot, Godless Iowan, Jennifer, Corey, and Heavy. You make what I do possible. Your contributions help me get a new camera. I've gotten a new desktop for my Hey ScientistMel 24/7 live stream. I'm able to do shows now and with better lighting, and I have a green screen I'm going to start playing with soon. So thank you. If you can spare $1 a month, hit me up on patreon.com/ScientistMel. You can find me all of these places. All of these places. ScientistMel.com. Resources there. Articles, quizzes, all kinds of stuff. Patreon starts at just $1 a month, and I have a show every Sunday, 3 p.m. for my patrons called Science Sunday School. Fantastic. We talk about all the latest and greatest on science. Periscope, YouTube, and Facebook. And I'm also on Twitch now, so yay! So I want to thank you guys for being here. And I appreciate you. And I know that sometimes depression and suicide, these are not happy topics. And sometimes it's kind of hard. So if you had to kind of leave, earlier before the finish, it's all right. come back to it and educate yourself when you feel more up to it. But thank you for being here. I'm sending you squishy science hugs. Bye. See you next time.